What are the complications of NORA? Some minor complications what we face in the OT, we also faced in the non-operating room, just like inadequate sedations or anesthesia, post-op nausea and vomiting, agitation and delirium, inadequate post-operative pain control. Although most of the procedures are non-invasive, but sometimes the procedures will create so much of pain and discomfort. So inadequate post-operative pain control, hemodynamic instability, minor respiratory complications when we use opioids for that, complications related to IV line placement, need for opioid reversal because the procedures are very short-lived and we have to reverse the opioid, like naloxone should be available. Sometimes we face desaturations and sometimes we face hypothermia because MRI suits or CT scan suits or these endoscopic suits are kept temperature below around 20 or 15 like that. So there will be severe chances of hypothermia, and desaturation we always face. So need a positive pressure ventilation should always be there. So major complications are rare, but it cannot be avoided. Cardiac arrest or death of the patient may happen. Unintended patient awareness, which is a medical legal issue. Vomiting and chances of aspiration is because as the lower airway is not protected and we are giving some amount of sedation. If the patient vomits, it may aspirate. Sometimes drugs can cause anaphylaxis. It is a major complications. Need to escalate of the care. Suppose sometimes the patient may develop severe desaturation and we need to intubate the patient. We need to mechanical ventilate the patient. Sometimes there will be severe hemodynamic instability. Respiratory complications like bronchospasms can anytime the patient can go, and sometimes laryngospasms also. Resuscitations, nervous system injury, wrong patient or wrong site, and fallout burns. These are all major complications, rare but major. So this is all about NORA only. I am taking so much of scoring system here only in these slides. I will try to cover up maximum scoring system because modified Aldrich score, post anesthesia discharge scoring systems, second thing Q SOFAs. These are all the questions which are asked regularly in the paper 2 and paper 3. So let us come to the modified Aldrich scoring system. This scoring system is used in order to send the patient from the operating room to the ward. So let us see what are the scoring system you will observe. This scoring system should be pasted in the PACO rooms, and this score should be easily done by the nursing staffs. When we get an adequate score, we can easily transfer the patients. Coming to the activity or motor functions, if the patient is able to move the 4 extremity or same activity level as preoperatively, then the score is 2. That means the patient is very much fine. If the one it is able to move only the 2 extremities or reduce activity or as level compared to the preoperative value, 0 when no movement is observed. So first point is activity. Second is the circulation of blood pressure. It is plus minus 20% of the pre-anesthesia value. When the blood pressure is fluctuated very minimally or very mild fluctuation of blood pressure, it is plus minus 20. If it is fluctuated between 20 to 50%, if it is fluctuated more than 50%, that the score is 0. Consciousness, if the patient is fully awake, the score is 2. 1 easily is erasable, 0 not responsive. So whenever a question came for to write the modified Aldrich scoring system, you just write this table. Oxygen saturation more than 92% in the room air, 2. Required supplemental oxygen to maintain 90%, score 1. Less than 90% despite supplemental oxygen, score 0. Respiration, 2 breaths deeply, cough and cries, so the patient may have a minimal respiration. The patient is normal respiration, so score is 2. Dyspnea, tachypnea, shallow breath, score is 1. If the patient is apnea or requires airway interventions like an IV or intubation, then it is 0. So we calculate this type of score. So here you can see the maximum score is 10. 1, 2, 3, 4, 5 parameters. Highest score is 2. So 2 into 5 is 10. A score of 9 is greater to accept the discharge. A score of 8 may be acceptable if preoperative blood pressure was not taken. So 8 to 10 score is good, but below 8 the patient required to be stay in either post-operative care unit for longer time. Coming to the post-anesthesia discharge scoring system, it is somehow little different from the modified Aldrich score. So here we see the vital sign first. If it is 20% of the preoperative value, it is 2. If it is 20 to 40% value of the preoperative value, it is 1. If it is varies from more than or fluctuate more than 40%, that is 0. Coming to the activity and mental status, if the patient is oriented and patient is conscious oriented and if it's steady gait, then it is the score is 2. Oriented or having steady gait, then it's 1. If the patient is neither oriented nor having steady gait, it is 0. Pain, nausea and vomiting. If the patient has no pain or minimal pain or vomiting, this is 2. Moderate requirement treatments, 1. Severe requiring more severe treatment, then it is 0. Surgical bleeding, come to say 2, it is minimal, 1 it is moderate, and 0 it is very severe. Intake and output, 2. The patient can take fluids and can easily pass urine, then it is 2. 1 has to take fluid or voiding, it is 1. The patient can unable to take fluids and the patient can unable to void, then it is 0. So the score of more than 9 is fit for discharge. It is mostly used for daycare surgeries. We can send the patient directly to the home if we made this type of score. Mostly DNC, upper GI endoscopy, colonoscopy, ERCP. Nowadays, different laser surgeries are also as a part of daycare surgery. So this picture or this scoring system should be pasted in the walls of daycare surgery room.